Thank you for joining us for this month's webinar. Our topic is exercise and diabetes, and our presenter this month is Dawn Cook. She is a health coach with Strategic Health Services.
Thanks, Sandy. Yes, my name is Dawn, and I'll be offering this month's webinar on diabetes and exercise. This is a very broad topic, and there's a lot of information for a lot of different populations. So whether you're healthy and want to prevent diabetes, maybe you have pre-diabetes and you want to try to prevent the onset of type 2 diabetes, or maybe you're already diabetic and want to learn more about controlling your blood sugars. Whatever the case may be, I hope that you find something in this presentation that's useful for you. So, okay. Here's what we are going to cover on this slide. But type 2 diabetes is being seen at unprecedented levels. We'll talk about the differences between the types of diabetes and how the increase in type 2 diabetes is tied to our national trends towards poor nutrition and exercise habits, a better understanding of what diabetes is, what the symptoms are, what causes it, who's at risk, will help explain how we can better approach reversing the trend of increased diabetes. And a brief description of how diabetes is diagnosed and treated will provide additional insights, as well as information about exercise for the prevention and treatment of diabetes, and for diabetics, and the importance of checking their blood sugar before, during, and after exercise will also be included. Okay, so what is diabetes? Well, the CDC describes it this way. Most of the food that we eat is turned into glucose or sugar for our bodies to use for energy. The pancreas is an organ that lies near the stomach, and this organ makes a hormone called insulin to help glucose get into the cells of our bodies. When you have diabetes, your body either doesn't make enough insulin or can't use its own insulin as well as it should. And this causes sugars to build up in your blood. Diabetes is a lot more prevalent today than 20 or 30 years ago. This slide shows a steep increase in its prevalence, thankfully from about 2006 to 2011, which is the last time that there was data on this topic. The number of new cases of diagnosed diabetes has shown no significant increase. Here are some of the signs and symptoms to watch for. Diabetes oftentimes goes undiagnosed because symptoms can show up very gradually and maybe not even be alarming initially. Knowing what to look for can help with early detection, and getting treatment as soon as possible can lower the risk of complications. So besides high blood sugar, extreme hunger and thirst, increased urination, poor wound healing, they're just some of the other signs of diabetes. When glucose builds up in the blood, instead of going into the cells, it can cause two problems. Right away, your cells may be starved for energy. Over time, however, high blood glucose levels may harm your eyes, your nerves, your heart, and other organs. Diabetes complications are the 7th leading cause of death in the United States. It is the leading cause of blindness in people ages 20 to 74 and is the most common cause of end-stage renal disease requiring dialysis to live. In fact, 10 to 21% of people with diabetes develop kidney disease. Diabetics are 2 to 4 times more likely to have cardiovascular diseases like heart disease and stroke, and are twice as likely to have dental diseases. Nerve damage caused by diabetes can cause a lack of or impaired sensation in feet and hands and may lead to limb amputations. Back in 2004, there were about 71,000 non-traumatic lower limb amputations performed on people with diabetes. Also, poorly controlled diabetes in the 2nd and 3rd trimester of pregnancy can cause complications and can result in excessively large babies. Okay, there are 2 main types of diabetes. In type 1, your body does not make enough insulin. In type 2, either the body doesn't produce enough insulin or the body isn't recognizing it and using it. The next couple slides will provide more detailed descriptions of type 1 and type 2 diabetes, but real quick, gestational diabetes is a little less common. It's a form of glucose intolerance that is diagnosed in some women during pregnancy. Gestational diabetes occurs more frequently among African Americans, Hispanics, American Indians. It's also more common among women who were obese before they got pregnant and women who have a family history of diabetes. During pregnancy, gestational diabetes requires treatment to normalize the maternal blood glucose to avoid complications in the infant. After pregnancy, 5 to 10% of women who had gestational diabetes are found to have type 2 diabetes. And women who have had gestational diabetes have a 20 to 50% chance of developing diabetes in the next 5 to 10 years. There's other types of diabetes also that result from specific genetic conditions such as maturity onset diabetes of the youth, or from surgery, certain drugs, malnutrition, infections, and other illnesses. These types of diabetes may account for only 1 to 5% of all diagnosed cases of diabetes. Type 1 diabetes was previously known as insulin-dependent diabetes mellitus, or juvenile onset diabetes. Type 1 diabetes develops when the body's immune system destroys cells in the body that make the hormone insulin, which regulates your blood glucose. This form of diabetes usually strikes children and young adults, and they may need several insulin injections a day or even an insulin pump to survive. But type 1 diabetes accounts for about 5 to 10% of all diagnosed cases of diabetes. There's really no way to predict your chances of developing type 1 diabetes, but it's important to familiar yourself with the symptoms. And risk factors for type 1 diabetes include things like autoimmune or genetic or environmental factors. The appearance of type 1 diabetes is suspected to follow an exposure to an environmental trigger, such as an unidentified virus or something that stimulates an immune attack against the cells that produce insulin in some genetically predisposed people. So with type 1 diabetes, it's very important to balance your insulin doses with the food that you eat and the activity that you do. Planning ahead and knowing your body's typical blood glucose response to exercise can help you keep your blood glucose from going too high or too low. Exercise is a key component of proper diabetes care. Along with all the other benefits that you receive from being active, your diabetes responds with more stable blood glucose levels with exercise. Your blood glucose response to exercise varies depending on your blood glucose level before starting exercise, the intensity of your activity, the length of time that you're active, and other factors. But sometimes people experience a drop in their blood glucose during or after exercise. So it's very important to monitor your blood glucose, take the proper precautions, and be prepared to treat hypoglycemia, which is basically your blood sugar goes too low. I'll be discussing more about testing your blood glucose and considerations for safe exercise more in detail later. Type 2 diabetes was previously called non-insulin dependent diabetes mellitus, or adult onset diabetes. Type 2 diabetes may account for about 90 to 95% of all diagnosed cases of diabetes. It usually begins as insulin resistance, which is a disorder in which the cells don't use the insulin in your body properly. As the need for insulin rises, the pancreas gradually loses its ability to produce insulin. Type 2 diabetes is associated with older age, obesity, family history of diabetes, prior history of gestational diabetes, as I mentioned earlier, impaired glucose tolerance, physical inactivity, and race ethnicity. But type 2 diabetes is increasingly also being diagnosed in children and adolescents. Type 2 is treated with lifestyle changes for one, but also oral medications and in some cases even insulin. Some people with type 2 diabetes can control their blood glucose with healthy eating and being active, but as I said, your doctor may need to also prescribe oral medications or insulin to help you keep your target blood glucose levels. Type 2 usually gets worse over time. Even if you don't need medications at first, you might need them later on. Some groups have a higher risk for developing type 2 diabetes than others. It's more common in African Americans, Latinos, Native Americans, Asian Americans, as well as the aged population. So why is exercise helpful, and what type of exercise is best, you might be thinking? Well, good question. When you exercise, your body needs extra energy from blood sugar. When you do something quickly, like a sprint to catch the bus, for instance, your muscles and your liver release glucose for fuel. So if you're doing an intense exercise like a sprint, your blood sugar levels actually may rise temporarily after you stop exercise. Now for diabetics, the real payoff comes when you do moderate intensity exercise for a longer period of time, like a hike or a brisk walk. Your muscles during this type of exercise take up much more glucose from your blood when you do that. So this helps lower your blood sugar levels. For this reason, it's helpful to get at least 30 minutes of moderate physical activity each day, even if you have to accumulate it in smaller intervals throughout the day, like 10 minutes in the morning, 10 minutes in the evening, or whatever. Now, prediabetes is a condition in which the blood glucose levels are higher than normal, but not quite high enough for a diagnosis of diabetes. People with prediabetes are at an increased risk for developing type 2 diabetes and also at an increased risk for heart disease and stroke. Other names for prediabetes are impaired glucose tolerance or impaired fasting glucose. Research supported by the Department of Health and Human Services shows that most people with prediabetes will likely develop diabetes within a decade, so 10 years, unless they make modest changes, just small changes even, modest changes in their diet and their level of physical activity, which can help them reduce their risks and sometimes even avoid the debilitating disease. So you can prevent or delay the onset of type 2 diabetes. And this is one of the many reasons why I became a health coach. We health coaches are here to help prevent these types of preventable conditions, as well as to assist you in improving your quality of life. So, screening is vital. Among people with diabetes, those who do not even know that they have the disease has decreased from 30 to 25% over the past few years. This is both good and bad. It's concerning to know that we have more people developing diabetes, but on the other hand, it's good to see that more people are aware that they have the disease, because with proper treatment, they can avoid some of the harmful effects on the rest of their body and organs. So, how is diabetes diagnosed? Doctors diagnose on the basis of high levels of glucose in the blood. There's different types of tests that they might run. There's screening and diagnostic tests. Screening tests, for example, are what you might do at your workplace. Diagnostic tests are a little more in-depth. But a fasting blood sugar is the screening test that we use. A blood sample is taken after an overnight fast. A random blood sugar test is a test that's done taking a blood sample at a random time, so regardless of whether you ate last or not. And the levels expected for this are a little higher norms than would be if you were fasting. An A1C test, or a glycated hemoglobin A1C test, this blood test indicates your average blood sugar level for the past 2 to 3 months. Well, how does it do that? it measures the percentage of blood sugar attached to hemoglobin, which is the oxygen-carrying protein in red blood cells. So the higher your blood sugar levels over time, the more hemoglobin that you'll have in your body that has sugar attached to it. If an A1C test is inconclusive or maybe it's not available, your doctor may have you do another type of test called an oral glucose tolerance test. For this type of test, you fast overnight and you have your fasting blood sugar level measured, and then you're given a sugary liquid to drink. And then your blood sugar levels are tested periodically for the next few hours. Now, women who have had babies might be familiar with this test because it's also used to determine gestational diabetes during pregnancy. If type 1 diabetes is suspected, your urine will likely be tested to look for the presence of ketones, which they're a byproduct produced when muscle and fat tissue is used for energy rather than glucose. Your doctor will also likely run a test to see if you have a destructive immune system cell associated with type 1 diabetes called autoantibodies. So there's a lot of different tests that your doctor may do. Okay, well, after all of that, you probably would like to know whether you're at risk. So get a pen and paper, and we'll go through a risk test together. The American Diabetes Association has a risk test on their website, and that link is on the screen right now if you want to go there and do it on your own. But we're going to do the paper version, so give me just a second to bring it up on the screen. And but basically, this questionnaire is going to evaluate your risk. So there's certain things that might put you at a higher risk. So get your pen and paper, and here we go. How old are you? So if you're less than 40 years of age, you don't get any points. If you're 40 to 49, write down 1 point. If you're 50 to 59, you get 2 points. And if you're 60 or older, you get 3 points. Okay, next. If you're a man, you get 1 point, and if you're a woman, you get no points. However, if you're a woman that has ever been diagnosed with gestational diabetes, remember that puts you at a higher risk, so you get a point. Now, do you have a family history? So do you have a mother, father, sister, or brother with diabetes? That puts you at higher risk. So if you do, you get 1 point. If you don't, no points. Have you ever been diagnosed with high blood pressure? If yes, that puts you at higher risk, so you get 1 point, and if not, no points. And are you physically active? Now be honest with yourself. Do you do more than just get up, go to work, come home, and go to bed? If you can honestly say yes, then you don't get any points. And if no, then give yourself a point. And lastly, use the chart on the screen on the right to determine your weight status. So in the column labeled height, it should look blue on your screen. Find your height, and then when you do, go across to the right. And if the first column that you come to is where your weight lies, you get 1 point. If you go to the second column and find your weight for your height, then you get 2 points. And if your weight is actually in the third column to the right, then you get 3 points. So now add up all your points, and if you scored 5 or higher, then you're at an increased risk of developing type 2 diabetes, and that is a discussion that you should have with your doctor. Again, here's the slide with the link on the diabetes.org website. You can go on and do that risk test again on the website. Okay, so now that you know your risk, what can you do to prevent type 2 diabetes? This slide here shows steps for prevention, and you can read that, but what if you already have type 2 diabetes? Well, it's still important to maintain a healthy weight or lose weight if you're overweight. And this recommendation is it's supported by research and isn't just something that your doctor tells you to lose weight. Here, in a research study on the topic of weight and type 2 diabetes, scientists reviewed data from a large group of more than 11,000 people who had type 2 diabetes. The researchers carefully controlled for other factors that might have their own effects on the risk of death, such as smoking or physical inactivity. But the normal weight group had the lowest rates of death. This is why maintaining a healthy weight or losing weight if you're overweight, if you have type 2 diabetes, is a recommendation. Now, if you have diabetes, also blood sugar management is key. Work closely with your doctor and take any medication as prescribed. Also take steps to eat healthier and control your blood sugar. Some people with type 2 diabetes may actually be able to reduce the type of the amount of medication need to control their blood sugars, and some may even be able to come off their medication with weight loss and lifestyle changes. It's important that if that's a goal of yours that you work closely with your doctor. But if you have type 2 diabetes and would like support on these types of health goals, reach out to your health coach today as well. Now, Sandy, our registered dietitian, will talk briefly about healthy eating. Sandy?
Thanks, Dawn. Although there is no one diet for all people with diabetes, there are recommendations for eating healthfully that are similar for heart health, cancer prevention, and weight management. To successfully manage diabetes, you need to understand how foods and nutrition affect your body. Food portions and food choices are important. Carbohydrates, fat, and protein need to be balanced to ensure blood sugar levels stay as stable as possible. And there are different meal planning systems for controlling blood sugar levels. Carbohydrate counting is a way to budget the amount of carbohydrate eaten at any meal or snack. And this method allows you to choose any type of carbohydrate food as long as the portion size you choose allows you to stay within your goal budget. Another meal planning method is based on food lists, which use food groups. And it's highly recommended that you work directly with a registered dietitian and certified diabetes educator to receive comprehensive training in diabetes self-management. And together you can develop a diabetes meal plan based on your health goals, tastes, and lifestyle. Good health does depend on eating a variety of foods that contain the right amounts of carbohydrates, protein, and healthy fats, as well as vitamins, minerals, fiber, and water. If you have diabetes, a healthy daily eating plan includes fruits and vegetables. Both fruits and vegetables provide numerous vitamins and minerals for just general good overall health. In addition, the fiber in both fruits and vegetables helps slow down your digestion, which can help you feel full and help with weight management, and also slow down or stabilize the absorption of blood sugars. When choosing fruits, choose whole fruits rather than juice, since you'll get the added benefit of fiber. When choosing grain foods, you want to choose whole grains versus refined grains. A few examples of whole grains, such as whole wheat breads, oats, and brown rice, are good sources of fiber which can help with stabilizing blood sugars, slow down digestion, and also keep you feeling full longer. You want to choose low-fat protein sources. Plant-based foods such as beans are a great choice since they're not only a good source of protein, but unlike meats, plant-based proteins are also high in fiber. For poultry products, choosing skinless breast can be a healthy choice. And when choosing red meat, choose leaner cuts of meat by looking for the words loin or round. And when choosing ground meats, choose 93% lean or higher. You also want to limit saturated fat, trans fat, and cholesterol. Diabetes makes you more likely to get heart disease, so you'll want to limit fat, especially saturated fat and trans fat. The main sources of saturated fats are cheese, beef, milk, and fried foods. Choose fat-free or 1% fat dairy products, and avoid trans fats, which can be found in many processed foods. Check the ingredient list for partially hydrogenated oils, since a product that says 0 grams trans fat may actually have up to a ½ gram of trans fat per serving, which over time can add up. And you want to limit added sugars. Added sugars are basically empty calories without the vitamins and minerals found in fruits and low-fat, fat-free dairy products. Limit sodium. Diabetes makes you more likely to get high blood pressure, so it's important to read food labels and choose products that are labeled no sodium or low sodium. And if you do drink alcohol, do so in moderation. Alcohol can affect the amount of blood sugar and the amount of insulin in the body, particularly when drunk in high amounts. And the recommendation is no more than 1 drink per day for women and no more than 2 drinks per day for men. Dawn?
Thanks, Sandy. Now that we've heard about healthy eating, I'm going to talk a little bit more about exercise. So regardless of the type of diabetes that you have, regular physical activity is important for your overall health and wellness. Diabetes and exercise really go hand in hand, at least when it comes to managing your diabetes. Exercise can help you improve your blood sugar as well as boost your overall fitness, reduce your risk of heart disease and stroke. But diabetes and exercise pose unique challenges too. Remember to track your blood sugar before, during, and after to make sure that you don't have dangerous blood sugar fluctuations too high or too low. Before jumping into an exercise program, make sure that you talk to your doctor, especially if you've been inactive in the past, and discuss with your doctor what activities you're contemplating as well as the best time to exercise and what potential impact any medications that you're on might have on your blood sugar if you become more active. But for best health results, it's recommended to accumulate 150 minutes of moderate intensity physical activities throughout the week, which equates to about 30 minutes a day, 5 days a week. However, it's best to be active every day for blood sugar control. So to avoid potential problems, check your blood sugar before, during, and after exercise. If you're taking insulin or medications that can cause low blood sugar, which is hypoglycemia, test your blood sugar 30 minutes before exercising and approximately every third during exercise. This will help you determine if your blood sugar level is stable or rising or falling, and if it's safe to keep exercising. But here are some general guidelines for blood sugar levels when considering if exercise is safe. So if your blood sugar is lower than 100, your blood sugar may be too low to safely exercise, so eat a small carbohydrate-containing snack such as fruit or crackers before you begin your workout. Ideally, your blood sugar, for most people, a good range is between 100 to 250. This is usually a safe pre-exercise blood sugar. Now, if your blood sugar is 250 or higher, this is a caution zone. Before exercising, test your urine for ketones, substances, as I said before, that break down when you're burning fat or protein. So excess ketones indicate that your body doesn't have enough insulin to control your blood sugar. So if you exercise when you have a high level of ketones, you risk a condition called ketoacidosis, which is a serious complication of diabetes that needs immediate treatment. So instead, wait to exercise until your test kit indicates absence of or very low levels of ketones in your urine. And if your blood sugar is over 300, your blood sugar may be too high to safely exercise. So just wait until it comes down into a safer zone. If you're not able to check your blood sugar, stop exercising if you feel shaky, weak, or confused. Now, we have a couple minutes left. I wanted to try to fit in some recent research about diabetes, but we're running out of time. So this slide discusses obesity and type 2 diabetes. So although obesity is known to be a significant risk factor for developing type 2 diabetes, most obese people never develop diabetes. Why is that? Well, there's actually a gene associated with it called SORS, S-O-R-C-S1, that was discovered and may make people more at risk for developing type 2 diabetes if they're obese. The good news is that studies show that keeping blood glucose, blood pressure, and LDLs close to normal levels may help prevent or delay diabetes and diabetes complications. And then this one, for anyone contemplating having a baby or someone who's already pregnant, I thought this was really interesting. Quickly, it just basically shows that the diet during pregnancy can affect your offspring, your children later. When animals, okay, so this study was done with mice. It showed that a high-fat diet during pregnancy and lactation sets up offspring to suffer more substantial negative effects when fed a high-fat diet later in adulthood. So the results basically suggest that the fetal environment was responsible for making the offspring more vulnerable to detrimental effects of high-fat diets later in life. So if you would like more information about this research, I'm sorry that we're running out of time here, you can message me or send me a message in my pathway, or even on the diabetes.org website, there's all kinds of research on there that you can go and look up. Here's a quick summary of what we covered. You know, I hope that you enjoyed this presentation and found some useful and new information. And check out diabetes.org. There's a plethora of information on there. Okay, well, this concludes our webinar. Thank you so much for joining. Don't forget that if you have any health-related goals to diabetes or prediabetes, contact your health coach. That's what we're here for, okay? Well, this will conclude our presentation for this month. Thank you so much for joining.